With a measles outbreak in New York State and in other parts of the world that has spread to a number of other U.S. states, there are some concerns tonight about that outbreak reaching Ohio. Now, so far, the Ohio Department of Health says there have not been any cases of measles here.
Yeah, News 5's Olivia Fecto tells us, though, local doctors say it's best to be cautious and proactive.
If there's one thing doctors stress, it's the importance of getting vaccinated. If you're in doubt about how many doses of the measles vaccine you've had and you may be traveling to an area where there's been an outbreak, doctors say get another one.
It used to be one of those diseases you got if you were a child: measles, mumps, chickenpox. All of them had terrible ramifications, and people don't remember that.
Dr. Lolita McDavid says measles is an extremely contagious virus, and children are especially susceptible.
It's spread by droplets, and so people cough and sneeze and touch things, and it's very easy. It's very easy to get the measles virus.
It begins in many cases with a fever and runny nose, but doctors say it can result in deafness, encephalitis, or even death. And though the Centers for Disease Control declared measles eliminated in the U.S. in 2000, this year's outbreak has involved 80 to 90 cases a week for the last few weeks, according to local doctor Shelley Senders.
This year's outbreak seems to be much stronger than any of the others, in large part because people are so mobile.
Right now, the outbreak has not reached Ohio, but doctors say in addition to kids younger than 5, adults who have only had one dose of the MMR vaccine could be at risk too.
This is really prophylactic. Cleveland is not one of the epicenters for this disease, and we just have to be a little bit proactive in preventing that.
Doctors also emphasize how important herd immunity is in keeping people safe from outbreaks such as these.
In the close communities like the Amish community or Orthodox Jewish community where we're seeing this, that's one thing, but we're more concerned about the parents who are not having their children immunized. That's the part that's the most crucial.
One of the doctors we talked to says you can be infectious up to 4 days before you really start showing symptoms, and another 4 days after you break out in a rash. During that time, doctors say you can spread the disease to other people. In Cleveland, Olivia Fecto, News 5.